Quiet, Jimmy. Dirty dog. Salad dog. All right. So as I said, first an announcement. Quiet. An announcement. Um, if anyone, the college is looking for student volunteers to help with contact tracing. That means you would you'd have all your PPE, and you'd have all the stuff that you need to protect yourself. And you'd just be asking people questions who try to get on campus, like, what's your favorite candy bar, or who am
What'd
I,
you do last night? No.
am I your best friend? Can I be your best friend? That kind of thing. Did you go to
I
bed?
already did it. I already volunteered my time. So
Okay. So if there's anyone else that wants to volunteer, it looked really good. Corey, just give it a second. Let me finish my pitch.
Fine.
all right.
Really
Hopefully
great on your resume, okay? Because it also tells the employer or the college that you're transferring to, hey, this person like is involved in the community. They've done something, and it shows what role you played in you know in this pandemic. Anyway, that's my pitch. So if you're interested, let me know, okay? Okay. Rip. Let's talk about prolificationism. Okay, fertility, pregnancy, and childbirth. Okay, so pregnancy and childbirth raise major health concerns. Of
Yep.
course, thank you, Corey. Before the advent of medicine, no amount of wealth or power could protect women from the dangers of childbirth. Today, 80% of all established pregnancies are viable. 99% of Americans, my dog is making so much noise. 99% of American infants survive. 1 in 10,000 mothers die during childbirth. Corey, that's so insensitive. Sperm enters the ova at the oviduct. Then it unites with the egg. The oocyte forms a zygote, a fertilized egg. Then, after a few divisions, becomes an embryo. The embryo then implants into the uterine wall. At this point is when it starts releasing human chorionic gonadotropin, right? This is what will stop or prevent the woman from going into her next menstrual cycle. This is also what we're looking for in pregnification tests. For a young couple who engages in unprotected sex several times a week, there is a 20% chance of getting pregnant every month. Ermagerd, 93% chance of getting pregnant in the first year. And if the couple does not get pregnant, they are subfertile. What do we call subfertile? It's an arbitrarily defined absence of pregnancy that warrants an investigation. As in, do you know how fast you were going? Oh, Kaylee left. Now Kaylee's returning. And who's that? Corey, who's your friend? Hi, friend.
She's doing great. Hi, friend. This is my Canadian housekeeper, and she makes me drinks.
I like the pants.
Thanks, babe.
Those are cool.
She's a good person.
Must be nice to be able to call everybody babe.
There is.
Yeah.
And it's not threatening either. It's nice.
That's why. People like legit go, he's not looking for nothing, Yeah.
I have a 0% chance of getting someone pregnant.
Yes, you do. See how I throw it in there?
Yep.
That's a Visco reference. You know that one?
What?
It,
Yeah, I was in your intro class.
okay. All right. I saw a little eye roll there. I wasn't sure. You were just rolling.
Not
Okay.
old, outdated.
Little one there. Infertility, the inability of a man, woman, or couple to achieve pregnancy. 15% of couples have a difficult time achieving pregnancy. And this should be known. There's an equal probability of it being caused by the man as the woman. The most common condition affecting fertility, poor quality spermatozoa. This accounts for 25% of infertility cases. How? Well, Could be that the testes didn't descend, right? If they didn't descend, that means they didn't mature. If they didn't mature, they don't produce the Leydig cells, and they don't produce the sperm cells, and on we go, right? There could be infections. There could be sex chromosomal anomalies, infections that lead to blockage of the reproductive tracts. Again, the heat, right? Whitey tighties can lower sperm counts, and chemotherapy can also kill sperm cells. What can we do? Artificial insemination, a technique that involves the placement of the semen in the vagina or uterus with the aid of a syringe or cannula. So when they're low, they just collect multiple samples and up the chute. Right, here's some examples of a cow. And I believe this is a cat. Now, why you would ever want to artificially inseminate a cat is beyond me.
Maybe it's like a purebred and they need to breed it.
Does that look like a purebred's hindquarters to you?
Well, honestly, I can't tell from cats' asses. I'm not that great at this.
Look at the haunches. Does that look like a purebred haunch? I don't
My
think
haunches
so.
look like that, and I'm pretty purebred.
You're bred. I don't know what that means either. All right.
I'll explain it to you later.
Okay. Thank
You'll
you.
learn when you're.
I'll learn what later? Okay.
I'll tell you later.
Okay. In vitro fertilization can circumvent many sperm problems. Now, these are any variety of assisted reproduction techniques in which the fertilization takes place outside the body. You might have heard the phrase test tube babe. That's what that's about, right? Collect the eggs, collect the sperm, put them in a little petri dish. Come on, push them in, give them a little kick, blow on them nicely. Give them a monster drink, just a little bit. Sperm can be donated. This is used when the male has genes for genetic disorder or when they're completely sterile. Artificial insemination by donor, know this, it's usually done by college students who are paid a small fee. Oh, child, everybody watch it. Child, alert, 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 alert.
She's gone through health and all that. She's good.
Okay.
She's 13.
Okay, okay, good. And not for nothing, the rule is, the general rule is, when people ask, what do I tell my children? We already know this, right? You know what to tell your children by what they can handle, right? What they can understand, right? So 13 is a safe age to have the talks.
Yeah, she's already had those talks. I mean, they were talking about it on the bus in like elementary school. So
Yeah, right. I remember when I was in 4th grade, my my parents opted to have me participate in something called LAMO. I don't remember what it stands for. It was a sex ed class for 4th graders. And my mother brought me to the first one, and then my father brought me to the second one. But the second one was about, it was like a series, and like it showed like pictures of people like having hot cross monkey time. And my father was so upset, like he had no idea what he got himself into. He never went again. So he was really embarrassed by it. We saw vulvas and peepees and peepers and peeps. Anyway, abnormalities in the female reproductive tract also may reduce fertility, and these account for 20% of the infertility cases. Could be the cause from pelvic inflammatory disease, like that would lead to scarred oviducts. Scarred oviducts would lead to the zygote getting caught. Does your father know how he made you? He does. He made 6 of us. He just didn't like talking about it. It's one of those, sex is a secret kind of thing. So scarred oviducts is going to prevent the zygote from getting to the uterus. It's going to get caught in there, right? So these are usually the result of an STD like chlamydia or gonorrhea. Failure to ovulate can be dealt with by drugs or by egg donation. Amenorrhea, remember the absence of the menstrual cycle? This accounts for another 20% of infertility cases. And this will be caused by natural aging, weight loss, athletic training, stress, like personal stressors, drugs, or even pituitary tumors. Now, pituitary tumors, the reason why that is because remember, it's the HPA axis that regulates our menstrual cycles. So if you got a tumor, it's not going to be releasing the why am I drawing a blank? The follicular stimulating hormone and the luteinizing hormone. You don't need to know that. Okay. Surrogate mothers will bear a child for someone else. The person stands in for another. They usually get paid 20 to 25,000 bucks to do it, and this is popular with gay male couples.
Hmm.
Adoption is limited by the supply of healthy infants. There's a severe shortage of healthy infants of the same race or ethnicity, and only about 50,000 per year are healthy in the US. Fertility declines with age. Both women and men are affected. 1 in 4 couples are infertile by their mid-30s. Children born to older parents have a higher risk of Down syndrome. They say the number, pretty much, is about 35 years of age. And that's for men and women. Okay, remember, for years, women would take the blame because we didn't know. Because people didn't know. And so when in doubt, hey, you're the one that made the baby, you messed it up. Many embryos do not survive. More than 50% of human embryos are genetically abnormal and have little to no chance of surviving. And often the case, women don't even know they're pregnant. Ectopic pregnancy can endanger the mother's life. This is where the fetus will implant in an area other than the uterus. This accounts for 1% of all pregnancies, and this may lead to, usually, early spontaneous abortion, or an internal hemorrhage, or if it continues to grow, a ruptured oviduct. RIP. No? Okay. I thought that was good. No? Hold on, let me scroll through it. Let me get an audience that I think is gonna laugh. Okay, I got Jesse and Quiet Baby. Maybe they'll smile for me. Before that, I had Tirza, June, and Corey, just straight faces can be.
Well, that's very hard, Mr. Cohn, to have a straight face when you're as gay as I am.
But
That was funny.
come on, it wasn't.
Dad jokes.
Did you say dad jokes?
Yeah, I'm a dad and a mom. I'm both parents because I'm single. And
Right,
we'll check
that's
to
true.
see if it's single.
That's good.
Mhm. Mhm.
Many embryos do not survive because of an RH incompatibility. So RH is an antigen on the surface of our red blood cells. If it's incompatible with the mama, she has to take a shot, an antibody that binds to the baby's RH and hides it like an invisibility cloak.
See what you did there.
See what I did there? Clever. Pregnancy is conventionally divided into 3 trimesters. We'll start the clock of the first trimester at the time of the last menstruation. Now that doesn't make any sense because she's not pregnified yet, right? Because that's the last time of the menstruation is about 2 weeks before fertilization actually happened. So the gestational age doesn't actually line up for that reason. So we use Nigel's rule, which is 9 months plus 1 week. This is 281 days after the last menstrual period. Also know that the time to delivery, to labor, to parturition is usually longer for a woman's first pregnancy. Well, whatever. If you want to figure it out, this is how you do it. Okay. The fetus secretes sex hormones to sustain pregnancy, right? The hormones are estrogens and progesterone that eventually pass into the mother's blood. This will also prepare the mother for childbirth and lactation prior to delivery. Okay, we're still in the first trimester, so women may experience symptoms during early pregnancy, such as morning sickness. It'll affect about 50% of pregnant women. Varies. Some have severe, some have very moderate, some mild. It's often associated with the aversions to certain foods, like strong tasting foods. Notice this is in red. When your friend or you are experiencing morning sickness, that's actually a good thing. It's correlated with a successful labor, a successful pregnancy. Frequent urination, tired, mood swings, sleep problems, backaches, and know what CUVAD is. CUVAD is with the pregnancy symptoms experienced in men. Usually it's weight gain. Questions?
No, but I got a comment to that. They usually have some of the same cravings.
Cravens.
Sometimes, yeah. Well, I've seen it. Like,
Thanks, babe. I got you, Corey. I got you. I got you back. She's like, who the hell is that creep?
Thanks, guys, for the warning.
I don't understand. She just gave you like the extras of it or something?
Yeah, we just worked out, and I'm trying to be healthy and whatnot. So it's
Gotta
all.
get your protein. Yep. Gotta get your protein on. Prenatal care provides health screening, education, and support. Numerous studies show that prenatal care benefits almost every aspect of pregnancy. Hang on. Expecting mothers need an additional 250 to 300 calories a day. An additional, okay? They can expect to gain about 20 to 35 additional pounds by full term. This accounts for the fetus, the placenta, the amnion, breast enlargement, fat deposits, and blood. Pregnancy is so pretty. When we say amnion, we're talking about the amniotic sac and the amniotic fluid. Adequate nutrition is vital to successful pregnancy. We need protein, right? Just like our protein shakes after a workout. We need calcium, just like our calcium after a workout. Vitamin A, I don't know. We need folic acid, right? Underweight mothers are likely to have underweight children. Overweight mothers have an increased risk of diabetes and hypertension, which is high blood pressure. Tobacco, alcohol, drugs, and radiation can harm the fetus. Tobacco can lead to spontaneous abortion, prematurity, addiction, SIDS, sudden infant death syndrome. Alcohol could lead to fetal alcohol syndrome. Drugs like cocaine could lead to addiction, heroin, spontaneous abortion, low birth weight, respiratory depression, and also addiction. Radiation can lead to cancer and a variety of birth defects. So we call these things, does anybody know what we call these things? These toxic agents that can cross the placenta to the offspring in the womb. There's a specific term for them.
You don't care if I take this off, do you?
It starts with a T. Yeah, I have the Coco Mocha Frappuccino and can I get one of those lemon scones? Flaky and yet moist. What is it called? Those toxic agents. Starts with a T. I'll give you $1 if you can get it. 3. Don't look it up. 2. 1. Okay. They're called teratogens. Salad dogs. Now, the second trimester begins at the 13th week of gestational age. I feel like we're all just having coffee with Jesse. This is great. I actually enjoy this a lot. I wish there wasn't noise, though. That's the only problem. What kind of coffee are you drinking? What are you drinking? Maybe it's not coffee. Maybe it's that chai stuff.
Maybe
Do you
it's
guys
all.
have that? Is it chai? Is it chai tea?
Mm-hmm.
Is it really? Hey, remember that green stuff that they were selling at Dunkin' Donuts that tasted like grass?
Matcha?
Yes.
I like that.
No. No.
It depends who makes it.
Okay, Dunkin' Donuts.
I don't know if I would trust a healthy drink from D&D.
It's not. I don't think it is, because unless it makes you throw up, and that's why it's healthy for weight loss.
I liked it better from Dunkin' Donuts than from Starbucks.
I never had it from Starbucks.
I like the Starbucks cup. That's about it.
You like what?
I like the Starbucks cup. It looks really good in my car. So
Yeah, it's a fashion thing. It's a statement.
it really is. It goes with all my outfits, and I feel a little bitchier when I have one.
Corey's a material person.
I'm a
No.
material girl living in a material world. Don't hate, appreciate.
No hate.
No hate,
Right.
no hate.
You'll be proud. I sold most of my shit. So now I'm very minimalistic, but I do like my accessories.
Accessories make the outfit.
They
Right.
really
Yep. Yeah.
children are a great way to pick up dads at the park. I'm like, I'm a single dad too. I don't know where this child came from, but I'm a pet parent.
Yeah, you got a dog. You got a pooch.
I do, and I really get a lot of attention from males because she's so small, and I thought it was going to be ridiculous, but guys are like, oh my God, your dog's so cute. And I'm like, really? I mean, I know she's the beautiful thing in the whole world, but I figured you'd go for more of like a German Shepherd.
Are you pinging when they do that?
I'm mostly curious to see if they're going to try to kidnap me or stab me or sometimes beat on me. I'm not really sure yet, but when they approach me, I'm kind of like, I'll kill you. But then I'm like, hi, good morning. Yes, she's mine. She's cute. No, I'm not straight.
Well, I didn't know if you could, but sometimes you can tell when others are not also.
Oh, sexuality is a very spectrumy thing, and it slides. So
Yes, it does.
I'd
But
like to
I mean, but if homosexuals polled say the gaydar exists.
I think
Yeah.
it's harder now
Because
Mine
because
is so broken.
Or, like,
Mine is so broken.
I think most men are bisexual. So with the right circumstances, most men will try things with men. It just has to be the right circumstances and the right
Yeah.
lure.
You tell him, Corey.
Interesting. You think that most men are bisexual?
In my experience, it's with the right.
Yeah.
I have a
Didn't we
lot.
talk about this? We talk about bonobos and stuff like that. Like anyone will literally have sex with anybody if it comes to it. Like literally anybody.
Yes, but that was for well, that was for like an extreme. Like I would if but it's not my preference,
Exactly. So that's what Corey means. Like he probably thinks that,
Relationship wise, most men are like, no, I'm definitely like into girls, but like I have had
No, it's all
more
right.
great guys been like, with just the right amount of like situation, like one-on-one or like casually having a couple drinks, suddenly they're like, oh, I'd try it. And I'm like, that's not what I asked. I asked where you got your sweatshirt from.
Right.
Not
I like your shirt.
Yeah. And they're like, yeah, I'll totally like try to suck a dick. And I'm like, that's not what I asked.
Let's kind of move on from that.
It's not what I asked.
Exactly. Thank you, Corey.
Hey, what do you want to order? Yeah, I'd do you. Like we're at a restaurant, bro. What are you doing?
You laugh, but I have had more conversations where I'm like, what did you say?
I believe it. No, trust me, I believe you. I do.
But then my nurturing side's like, don't make it weird. Don't make it weird. They're exploring their sexuality. If you make it weird, they'll repress it and they'll become angry men that beat women. So just let them do it.
Right. Oh, okay. That's okay. All right. Can we? We're gonna go back to this.
Thanks for the TED
love
Talk.
to go back to
Thanks for the
pregnancy.
TED Talk.
I would love to go back to pregnancy, Jared.
Okay. So we have to. I would rather talk about what you're talking about. To me, that's more interesting.
Mm-hmm.
Because all research shows that it is far more likely for women to identify as having lesbian or bisexual tendencies than men, which if anecdotally, if you're accurate, then that speaks to the culture.
Openly, yes.
Yeah.
Openly, women are more admitting of it. Men will not admit it. Men will not out loud to the broad people.
Yeah.
One-on-one,
Right.
we're like in a more
Intimate.
casual atmosphere. They're more likely to be like, oh yeah, well I've considered that.
Interesting.
Well, yeah, and it's also like loving, finding interest, like having a sexual interest in men is seen as subpar because that's what women have, and it's always like lesbianism is more accepted socially, because it's perceived more so as like a porn category than anything else, but finding love in another man is seen as like it puts you on the level of a woman, and being a woman is the worst possible thing that you can do in this society. So it's like you'd be more willing as the low echelon of society to be like, yeah, I've done the do with another one of me. But if you're a man who's just like intrinsically on the upper level, you're like, I do not commune.
Mm-hmm. Yep. It's a cultural influence. Absolutely. Yep. Interesting. Yeah.
And so has spoken the class homosexuals. Continue with your pregnancy.
You know what? Okay, we're gonna go on. Thank you. I'm not even gonna. Okay. Let's see. Okay, so the second trimester, but that's none of Corey's business. The second trimester begins at the 13 weeks of gestational age. This is a period of calmness, right? And kind of a well-being. Here's where the glow comes, right? Morning sickness tends to fade, but peeing does not. It actually gets worse. The breasts begin to swell and may begin to expel what's called colostrum. This will help prevent jaundice. It helps the baby's bowel movements. It contains living cells, antibodies, enzyme, probiotics, and anything else that a particular baby may need at the time of birth. Quickening. That's the quickening is the onset of the feeling of the fetus moving, right? When you start to feel it, that's the quickening. Not like the quickening in the Highlander movie. That's an old person's movie. But anyway.
Yeah, we're not there yet.
Yeah, I know.
It's appreciated, but it's not
See?
accepted.
That's more pop culture stuff. Look at that. See what I did?
Yeah, snaps for you.
Snaps. Tests
Can I add something?
Yeah.
So I find it very funny that we're learning this right now because my best friend just had her baby yesterday.
Ooh.
So this is nice.
Dude, Angela, remember that class where we all talked about the phrases of marriage and all that?
Yeah.
Yeah.
That weekend, my sister was like, "I'm having a surprise wedding." So I'm right there with you.
I
Well,
love that.
this is our lives, right? That's what makes this class so special, is because we're living our lives, and that's what this is about, really, every day.
Most of the class, I suppose, but pregnancy and women aren't necessarily on my to-do list. So I would say this is like 1% of my world.
But you have friends who get pregnant.
Not because I want them to.
Okay. All right, stop. All right. So how can we detect abnormalities? We could use ultrasounds, right? So you're blasting. No, you're just using like sound waves, right? And they're bouncing back. And it's picking up on structural abnormalities, but you can visualize the muscles, tendons, and the internal organs, size, structure, lesions with real-time images. You can also test the amniotic fluid. It's called amniocentesis. And then this will detect, if there's any kind of like hormonal abnormalities. You can also pick up on genetic abnormalities this way, but it's not as accurate as chorionic villus sampling. And here you're actually taking like a little chunk of the placenta out. Sex during pregnancy is healthy, but of course you can still contract an STD. No air blowing into the vagina. No effect on the timing of labor, meaning sex has no effect on the timing of labor. People used to believe that. They used to say, "Oh, have sex," and that there was something in the semen that would precipitate the induction of labor. But there's really no research that actually shows that to be true.
Why are we not blowing air into the vagina?
Okay, so I intentionally skipped over that, waiting for someone to go, "What's that about?" Why'd you do that?
Yes, I didn't know that was a thing until just now. So
what happens is that by putting air into the vagina, it could get up into the uterine area, and it could actually enter the bloodstream.
So you could kill a lady by blowing into her vagina?
Kill the baby.
Oh. By blowing it. Oh my God. Who thinks of these things? Who tries them out?
Why does it need to be said?
Yeah.
Yes. And I believe I looked this up, if I recall
correctly. You knew about it.
And it's a sex thing. Yep.
Okay.
Yeah.
I'll be Googling that later.
Yeah. And lastly, try new positions, right? Because the normal missionary style, you got something in the way there now, and it's not going to be very comfortable. Okay.
Nope.
Okay, so the second trimester is the easiest. Moderate exercise during pregnancy is beneficial. It'll help with backaches, constipation, mood swings, sleeplessness, but you want that moderate, low impact. You don't want to be doing jumping jacks. Now on to the third trimester. This will begin at the end of the 26th week, okay, where the fetus weighs about 2 pounds. It begins breathing motions, starts having more vigorous movements. The Braxton Hicks are false labor pains. Still more backaches, more frequent urination, more fatigue, more sleeplessness, and depression is not uncommon during this phase. About 1 in 8 women will experience it. Listen, Linda, listen. A hospital is the best place to have a baby, okay? Period. There are 3 places. You could do it at home, in a hospital, or a birthing center, which is specialized for childbirth, okay? But, and here's why I say, I'm emphasizing, a hospital is the best because if there are any complications, a hospital is going to have the best resources available to address them. A birthing center will have some, but not everything. So childbirth classes prepare the parents for birth. There's the Lamaze method, right? You're focusing on relaxation, breathing, okay? Then there's the effleurage method. Light rhythmic stroking of the abdominal or thigh muscles reduces pain perception. This is all according to, I shouldn't say, this is all substantiated by what's called the gate control theory of pain. Don't worry about it. It's just confusing your nervous system. Then there's the Bradley method, where it stresses the role of the partner as the birth coach and seeks to avoid medical interventions, a natural childbirth.
I was natural. I was 4 pounds, but I was natural.
Yeah,
I was little.
you were early then.
Nope.
Then your mother was a heavy smoker.
Yep.
Okay. My mom was a heavy smoker too. In fact, her OBGYN told her to smoke.
Yep.
To lower the birth weight.
Stress.
Huh?
Reduce stress.
Well, that I guess is one part. I mean, I know they still tell women to cut back, not to quit, at least in the beginning, because the stress. But it was actually to lower the birth weight of the child. They knew that it was going to lower the birth weight of the children coming out. So he's like, "Hey, you're small." My mom is small, right? He's like, "Hey, you're small. You go ahead and keep smoking."
Yeah, my mom was little too, and they said that because she thought about quitting smoking. They're like, no, it's good for your stress levels. Just keep smoking.
Huh. The fetus also makes preparations for birth. Organ systems undergo rapid maturation. Much of this is controlled by the adrenal glands. They release hormones to mature the lungs for breathing and the liver for manufacturing glycogen to supply the brain with glucose. Now, on to labor. It has 3 stages. Parturition is what we call the delivery of the young, okay, or childbirth. Labor is the process of childbirth. So before labor begins, the fetus changes position. This is called engagement, where the head goes from up to down into the lower position of the pelvis and presses against the cervix. This happens earlier for first pregnancies, about a week to a month prior to labor. It's still unknown as to how labor begins, what triggers it. But check this out. This is rad. The leading theory is that there's a signal, a electrical, chemical, neurological signal that comes from the fetus's brain that says, "I'm out. Peace." Now, the first stage of labor is marked by uterine contractions and cervical dilation. Discharge of the mucus plug that seals off the cervix. The plug may have red, so it's gone, right? You lose it, you discharge it, right? The plug may have red color due to blood, and then as a result, what may or may not happen is the water breaking, the rupturing of the amniotic sac. So amniotic fluid is exiting. Contractions are coordinated tightening of the uterine muscles that's mediated or controlled, we'll say, by oxytocin released by the posterior pituitary gland. Now, the softening of the cervix, because it was a harder tissue, the softening of the cervix is when we have the elimination of some of the soft connective tissue. The dilation, and we want to get to a point where it's transition, which is the final phase of dilation, is when the cervix goes from small to eventually transition. And I forget, June, you've had babies. What's the centimeters you're supposed to get? I should know, but I don't.
10 centimeters.
Is it 10? I want to say 9. 10?
10.
10. Okay.
Oh,
That's what I was always told. So,
Yeah, that makes sense. For some reason, I was thinking 9. I don't know why, but
that's a lot.
I'm going to go with someone who's actually gone through it.
Mhm.
Delivery is accomplished by uterine contractions aided by, quote, bearing down. The passage of the fetus through the birth canal is variable in duration, may last minutes, may last hours, may last days. Crowning, the baby's head appears at the vaginal opening. Episiotomy is the cutting perineum to reduce perineal tears as the baby passes through the vaginal opening. Now, they don't like to do that because the healing takes a lot longer than just tearing. Because if you slice it, you cut it like this, it's smooth here and it's smooth here. So it makes it hard for it to form those kind of bonds, the skin tissue bonds. So if it's ripping, goes like this, crap, like that. Now you have teeth to sink into, and it kind of gets inside, woven in, and it heals faster and stronger. So here's the cartoon of an episiotomy.
No.
I have a
Turn
question.
away.
Can I ask a question?
Yes.
Okay, before we move on. First section, can you like if say somebody gets pregnant and can you just do you have to have a reason to have a C-section or can you just say I want a C-section over natural birth?
there's got to be a reason.
That makes me so mad. I don't like that. Like I don't ever if I ever got pregnant and I didn't know and like the state made me keep it because of the laws or whatever and I had to give natural birth, I would be so mad. Like I don't want anything to ever come out of my vagina ever. Like I
It's
would
gotta go-
rather get sliced and taken out. Like why is it their decision?
Oh,
It's got to be, it's cost effective by insurances. You can't just decide.
It's the insurance companies.
so if you
Yes.
can pay for it in cash, you can decide what you want, Kaylee. Get
All
your.
right, I gotta start a fund. I gotta start.
Not necessarily either that, right, Cone?
Well, yeah, because it's also there are more complications medically.
Yeah.
But I don't care. It's my body.
I don't know. We just talked about slicing open like your perineum, and that just sounds
Yeah.
awful.
Kaylee,
There's
I
a
don't
lot of complications. I almost died my last child.
Oh
So
my god, I can't.
yeah, Kaylee, I don't disagree with you.
Ah.
I don't either, but there's a lot of complications.
Oh, I
with
completely
it.
agree there's complications, but like I would rather die, I think, than have a child come out of my vagina.
Me too.
You know,
Really,
No.
honestly, that's the truth. Like I don't think I could ever go through that.
a lot of women think that giving birth feels good. No, that's not true. I'm just
What?
I was gonna say
Who said that?
I got all the way to the end with my son, and then he wouldn't come out because he had the cord wrapped twice. Like I had to go for emergency C-section right away.
So you
It's
had
not
all-
fun
You
either
had
way.
all
It's
that time pushing, and they cut it out at the very end. I would be so mad.
I was 24 hours in labor.
And then they went the cheap shot on the way. I would have been so mad.
I'm glad they did because he came out purple. So
Oh my god.
Wow.
Ugh.
Hey, Kaylee, the fun thing about pregnancy is that, like, your brain will literally make you forget the degree of pain that you were in. So you're like, yeah, I think I could do that again.
Yeah, let's hope so, huh?
So you can't trust nobody, not even yourself.
You know, it's interesting. I don't know that I'm not disagreeing with Jesse, but I'm going to add to it. We'll say, or I'm going to change it. I'm going to alter it slightly, and I'm going to say, I don't know that the brain really forgets. I think the brain forgives.
Oh, that's so nice.
It
My
makes-
imaginary uterus is like contracting, and I just want to die.
Yeah.
Everything hurts.
Okay. Well, here we go. Rip.
Oh my god, stop.
Oof.
What? Oh my god, I can't. That's not gonna smell nice.
Why would you do that? That made my stomach.
oh yeah, you're right, Corey. Go.
Well,
I'd be less
they
concerned about
sew
the
it up.
smell and just like the blood.
They sew it up. Did
And
the
viscera.
creatures like dissolve?
I don't know if they are like the dissolvable ones or not.
God.
But I know they sew it up.
Oh god.
It's not like they just leave it.
Oh my God.
Poor Corey.
You see how Corey responded? He first went like this. He's like, no. Then he was like, no. He's like,
Okay.
"Open a little bit."
I can't.
He's like tunnel vision, then no vision, then peak.
Is that supposed to make you shiver like that? Because I can't even look at the
Oh.
picture. I cannot. I'm serious. Like I'm not even overreacting. It makes me sick.
Yep. Yep. No, that's normal.
But as a woman though, like I feel like women probably
It's
should.
a woman. It's a really pissed off man otherwise. They cut too far.
God, Corey and I are like the same person because I am not having this right now.
I am just glad I'm not a lady because man, whoo.
Yep. I'll tell you what though, you know, we can say all day, we can talk about it for the rest of our lives about how much pain and suffering that women go through. But truly, that is one of nature's gifts that men will never have. And anybody can say how much of a pain in the butt it is, and literally and figuratively speaking, but I will always be jealous of my wife because she was able to breastfeed and hold and be that nurturing individual. That's just irreplaceable to me. And
I do wish I could get pregnant. I just don't want the baby to come out. So like that's where I'm at. I would love to be pregnant. I just don't want it to come out.
yeah.
It really sucks to be a woman who like literally is the opposite of that. Like, and it sucks for you to be a man. It just makes me so mad. Like you have the mindset that you really wish you could. And I'm like, I wish I was infertile. Like I would never want to even.
Oh, Kaylee, no, I don't wish I could. That's not what I meant.
No,
I meant-
you have like the you have
Oh,
the
you don't
mindset
want
that
your
you wish
parent
you would be able
to
to
be
do that with your
spiced?
child.
yes, I am jealous of the relationship.
Yeah.
Yes, I am.
Yeah,
Yes.
that's what I mean. And I'm
But
like,
I
I would
wouldn't-
never want a relationship with a child like that.
I wouldn't trade for a second. I
Yeah.
would not trade for a second because I
It's just
also
sad.
see how crappy they treat her. They
Oh.
do. She's like, go clean your room. They're like, hey, Mom, I don't know about that. And they're like 9 years old. I don't know. And then Christina will say, Jared, tell your daughters or whatever to get. And I'm like, go clean your room. Like, okay. And off they go. It's always been like that. I don't know why kids won't listen to their moms. They just don't.
They never do.
No, it's terrible.
And I'm a single mom and they don't listen to me.
Yeah.
The mothers are more nurturing and the fathers are more
Right.
like dominant and commanding.
Dominate, yeah.
Yeah, I guess.
I'm
I don't even
bold.
hit my kids. I don't even know why they're afraid of me. I yell at them a lot though. Anyway,
It's a man voice.
it may
It's-
be. Yeah, but I don't have a man's voice. All right, here we go.
No, you
Not
don't.
really. No, I really don't. I know. Okay. I sound like a pubescent 14-year-old.
Oh,
Okay.
we're hitting below the belt now.
What?
Oh.
No, that's me, not you. That's me.
Oh no, I have a gay voice, so I mean, I can't go deeper. I try.
Your voice is fine. There's nothing wrong with your voice. It's not, you know what it is? At least it's not nasally like mine.
Oh, like Fran Drescher? I love her.
I have a nasally voice. Can we just go on with this? Okay. So the newborn child adapts quickly. All right. The squeezing of the fetus's lungs as it passes through the vaginal opening squeezes the fluid out from inside the lungs. It's cleaning it out, right? So still oxygen is getting it from the mother. It's getting oxygen from the mother because the umbilical cord is still attached. At first breath, the baby's, it's not the circulatory system per se, it's the pulmonary cardiovascular, right? The cardiopulmonary, where the blood starts to transfer from the left side to the right side, or right side of the heart passes to the lungs to the left side, meaning it starts to actually do the whole oxygenation, decarbonization within the lungs kind of thing, the waste exchange. Okay. So the umbilical cord is cut and the baby is now a free living organism. Now we have to explode the placenta. This is the afterbirth, whose delivery constitutes the final stage of labor. Premature and delayed births are hazardous. More than 3 weeks early, considered premature. What are some common causes? Having multiple fetuses. I know it's weird, but just multiple children, like twins, okay? Teen pregnancy or tobacco and other drugs. This accounts for 10% of all pregnancies in the US. 2 weeks or more late, we call this delayed. And this accounts also for 10% of all pregnancies in the US. But these individuals are 3 times more likely to die neonatally. So that's why they'll induce labor using an artificial drug that mimics oxytocin, and it's called Pitocin, which will cause the uterine contractions, the cervical thinning, the dilation, all that. Now we have postpartum, post, after partum, parturition, the period after birth. It's a highly variable experience psychologically. Some like it, some don't. Right? There's the postpartum depression that may be accompanied by disordered thinking. The baby blues, which is depression in a mother during the period after birth, is somewhat common, but a small number of women experience these depressive symptoms also with disordered thinking, and we call it depressive psychosis. And you'll see this in some of your friends. Ah, there you go.
My mother had 9/11 happen right after my birth. So,
Wow.
Yeah.
Here she is holding you going, what is the world coming to? Yeah. That's awful. 9/11, man. That was the day. Childbirth and parenthood affect sexuality. Obstetricians often advise women to wait 6 weeks before resuming sexual activity. Some women are concerned that they are viewed as less attractive because of stretch marks, weight gain, stretching of the vagina. But all of these fears are ill-founded because most of them, if not all of them, will be reversed to normal. There will be some stretch marks, possibly. Sometimes they go away entirely, but the vagina returns, the weight returns. Not always, but sometimes it does. June?
When you get older, the stretch marks don't really bother you.
Yeah.
A lot of moms I know, they're like, yeah, that doesn't bother me.
Anybody that a good woman is going to engage in sex and have a baby with a good man, the good man's not going to care anyway. Truth.
Right.
If the man cares, then he's a shallow
Exactly.
piece of garbage. No, I'm just he's not he's
No.
not a good person though.
No, he's not a good person. No.
I mean, not a good person. Yeah. Remember, sex is bigger than all of us. You know? Sex is bigger than all of us. Sexual arousal, sexual attraction, it's bigger than all of us. You get past it. Lactation is orchestrated by hormones. Prolactin, which is released from the pituitary, promotes lactation. So now we got the milk being produced, but now it needs to leave to go down to from the mammillary glands, right? It needs to go down the duct. Okay, it needs to be let down. That's the oxytocin, right? Again, from the pituitary, promotes milk letdown, which is the ejection of the milk into the milk ducts. So response to tactile stimulation, tactile means touching, like in this case, we're talking about sucking, that can cause the release of oxytocin. Also, it can be a conditioned response to the sound of crying. The content of breast milk will change over time. In the beginning, it's heavy on colostrum. This is the milk that's produced in the first few days after birth. It's low in fat, but rich in immunoglobulins. As a result, it is common for babies to lose about 10% of their body weight at first because it's lower in fat. So the reason why I put this guy here.
That was my next question.
Because I, like mine's, because I Google search random things of like pick random words in the slide. And in this one, I just put low body fat, I think is what I.
Oh, that makes sense. All right.
So this bloke.
And it looks like you facially.
I was thinking the same thing, Jesse.
Who, me or Corey?
You.
Yeah.
It looks just like you. I was thinking that when it came up. So I started cracking up. I don't know if you've seen that. I started laughing.
Oh, Jared, I knew I liked you. Is that what you look like?
I see the ears. That's about it, though.
The nose, too.
The nose.
Nose?
The nose,
The
yeah.
Smile.
Yeah. Yeah. You
All right.
cut your hair just like that, and I bet you he'll look like
I'd have to dye it, and I have to put on like 40 pounds of muscle mass. I don't know. Ain't nobody got time for that. Infant formula is an alternative to, but I know you do. Infant formula is an alternative to breast milk. Other options, a wet nurse where someone else feeds the baby from their breast. Infant formula is manufactured breast milk. In the 50s, 1 in 5 women breastfed, but in the 70s, the numbers began to rise. And currently, and it's actually higher than 77% of women breastfeed their babies now. Breastfeeding has many advantages and a few drawbacks. Benefits: baby's going to be healthier. Simple. That's it. The mother's going to be healthier, right? It helps the uterus shrink. There are psychological benefits, right? That bonding between the mother and the infant. It's convenient, as in it's cheap. It's easy. I know what you're thinking. Not always. It's not. And that's what one of the disadvantages are. It's also a form of contraception. It decreases fertility while breastfeeding. So does that mean to use it? No, don't use it as a form of contraception, but it does decrease fertility during breastfeeding. So some of the disadvantages: it hurts. The nipples can become inflamed, cracked.
Oh,
There are also health problems potentially for the baby. They can acquire some diseases like HIV from the mother. And then here comes the inconvenience. Where do you do it? And when do you do it? Like, it can be easy at night. You don't have to warm up a bottle or warm up a formula and run downstairs and do all this other stuff. You can just, have the baby in bed with you real quick and just plop over a breast, and there you go. And then plop over the other breast. There you go. And go back to sleep. Everybody's good, right? Happy baby, happy mom. Everybody's relieved. But what do you do during the day when you're out in public, right? For a lot of women, it's uncomfortable.
yeah, which is very sad because it's just a boob. So just do what most women do and find a nice closet and hope there's not a pee bucket in there and just, I guess, do your thing in shame.
Yeah. I think over time we're getting better and better accustomed to it. And see, now we know that the breast is a sexual appendage. We know that. We know it. It definitely derives sexual pleasure on behalf of women and men both. Okay. But it's also a reproductive organ. So I think that we're getting closer to understanding that, okay, not everything is sexual. Like, this is not a sexual thing. Breastfeeding is when the sexual part of you turns off. Remember we talked about loving, and there really was no difference in the brain between loving your child and loving your lover. It's just that the sexual part of your brain turns off. That's what should happen with breastfeeding. The sexuality, the sexualization of it should turn off. And you go, oh, that's normal, baby feeding. I'd like some fries, not chips with my sandwich, please. And on you go.